Angie, the clinical mental health counselor. This is the introductory PowerPoint. I'm going to go briefly through the slides, and then there's a video that I'll play for you, and I'm asking you to create an introductory PowerPoint as well. Which you can see in this slide. I'm asking for about a 2 to 3 minute video, just a brief video introduction that you can insert into your PowerPoint presentation. You can also use photographs or images to support your introduction of yourself. Canvas, I will say, is sometimes a little funky, and if it gives you trouble uploading, you can record your PowerPoint through Microsoft PowerPoint and then upload it to YouTube and just send a link into the discussion post. So if you're having any trouble uploading your files, that would be a great way to go about doing so. But I have a template here that you can use, and you can fill in your answers to the introductory questions on the remainder of your slides as provided in this PowerPoint. I'll also offer a blank PowerPoint presentation in the module for week 1 if you just want to copy my format. That will be one without the video, but you'll have the video in this one. So after you create that introductory PowerPoint, you can post the presentation to Canvas in the discussion board for this week. And please post it as an attachment or as a link to YouTube. And then over the course of the week, you can view your peers' PowerPoints and introductory videos and engage in discussion with at least 2 peers in the class. And for this introduction to the course, let your creativity guide you and have fun. Here you will see my video. I will go ahead and play that for you in a moment. But to the side, you can see that I've listed the license that I hold, my certifications, education, credentials, and then the settings that I've practiced in. And I'll talk a bit more about that in this video. Hello, clinical mental health counselors. My name is Dr. Akers, and I am thrilled to be joining you in your journey this semester. Welcome to the Clinical Mental Health Counselor course. This is a course in which we'll cover a wide array of topics. We'll look at professional and ethical issues within our profession and the roles that we hope to play in our future work as professional counselors. This includes our work with clients, our approaches to wellness, as well as the ways in which we might collaborate with other allied professionals. We have an informative and I hope engaging semester ahead of us, and I'm excited to see where we all go together. So I wanted to give a video introduction to let you all know a little bit about myself, and I look forward to watching and engaging with the videos that you all create because I know that we will be meeting online. So I'm hoping that these videos will help us to get to know each other with a little more nuance and depth so that we can get acquainted in a way that kind of makes up for the fact that we won't be meeting in person. So, as I mentioned before, my name is Whitney Akers. I am an assistant professor at UNC Pembroke, and my pronouns are she, her, and hers, and I also go by they, them, and theirs. And we can talk a little bit more about pronouns as we get into our work together, specifically in terms of how they will relate to you serving clients that might identify beyond or outside of the gender binary. This is also a topic that we will talk about with much more depth in the gender and sexuality course that you all will take, whether it's next semester or beyond that. But I've put a few questions on the PowerPoint in the hopes that you all will answer them in your own videos. So I'll go ahead and answer them for you here. So one of the questions that I'm asking you all is what you hope to get out of the course. For me, I'll kind of flip that question to address what I'm hoping to offer in the course for you all. And this can also shift based on what you're asking for. I want this to be interactive. I want to make sure that your needs are being met. But starting out, not knowing what you all are seeking, I will tell you a little bit about what I'm hoping to offer. And to answer that, I believe that entails telling you somewhat about my journey and my history as a clinical mental health counselor. So over the course of my career in this field, I've worked in a very diverse grouping of settings, and I'm hoping that that will be helpful in addressing any of your questions, concerns, or curiosities over the course of the semester. If you have any shared interests with me, please connect with me about those. And if you have any places of practice that you're wondering about, if they might be a fit for you, hopefully my varied placements can help support or illuminate these pathways as you move through this semester. So to tell you a little bit about my history, I've worked in spiritual care centers in which clients have been diagnosed with cancer, and they're either in treatment, remission, or looking at end-of-life concerns if their cancer has progressed to a terminal stage. I've done a lot of work with death and dying, as well as healing when we're in a space in which our mortality is made very present, very palpable for us in the moment. That was an incredibly fulfilling setting, and I got to do a lot of work with spirituality and even integrative yoga there. So that was really neat for me to blend some of my passions for yoga and that physical and spiritual practice with the healing that some of my clients were needing during that time. So I've also worked in hospital settings, once in an integrated care setting in which I worked with patients coming into a level 1 trauma unit with substances on board. So this trauma unit accepted patients involved in very critical injuries and serious accidents. Really, any type of trauma that would necessitate the highest level of care that would be provided on this high intensity and acute care trauma unit. I worked on an integrated care team with counselors, surgeons, nurses, social workers, and doctors. So, over our time together, we will address integrated care because this is the direction that counseling is really moving in. So, I can kind of give you a glimpse into what counselors' roles might look like in an integrated care setting. I also greatly grew from another integrated care experience in which I was a counselor on the child and adolescent, as well as the adult behavioral health inpatient unit. And this was in a behavioral health hospital. Here, I offered individual and group counseling, and I collaborated with doctors, psychiatrists, psych nurses, other nurses, recreational therapists, and social workers to provide services to clients who are in need of that acute care. And this is more acute psychiatric care. Often these clients were involuntarily or sometimes voluntarily committed due to the need for this level of intensity in terms of their care, in terms of accessing resources and services. So these clients could be admitted for as few as 3 days to more than 2 weeks, depending on their specific needs. But they were often experiencing high levels of suicidal or homicidal ideation, some high-risk self-injury, psychosis, for example, maybe adolescents who are experiencing their first break from reality within that diagnosis of schizophrenia. And others had other severe mental illnesses upon admittance to the inpatient unit. And I would work with individual patients and their families with the aim of stabilizing the patient so that they could return to their outside lives. And if you notice I'm using patient language here, typically I use client language, but in hospital settings, sometimes the culture is to use patient. And in an integrated care team, that's going to be kind of shared language. And it might start to shift, but from my experiences, that's where it was. But I've also worked in community agencies and partnered with community stakeholders to bring access to mental health and wellness to community members. This role was really situated in a small rural town in Louisiana, and this was very different from my previous settings in larger cities. My populations that I served experienced many diverse kind of journeys in life that I had not been familiar to working with. But I was able to serve clients diverse in age, race, ethnicity, religion, spirituality, socioeconomic status, sexuality and gender identity, ability, really a very, very diverse group of clients. And I was really grateful to have the immense privilege of working with a large population of queer and trans youth of color. And these clients were involved in the juvenile justice system. So that really allowed me to be able to consult with the Office of Juvenile Justice Services to train probation officers and detention center staff on offering intersectional and gender affirming care for my clients while they were in detention settings. And this is something that they really did not have access to previously because no one had really taken the time to do training and education in terms of affirmative and liberatory practices. And so it felt like a calling to be there. And I feel really grateful every day for the experience that I was able to gain personally and for the changes that were implemented because of some of those partnerships that were created. So currently now, I have my own private practice in Greensboro, North Carolina. This is where I live, and I commute into Pembroke. I don't know how many of you commute in or live locally in the area. But in this private practice, I serve many queer and trans clients, as working with these populations is a deep passion for me. I hope I can offer insight and information to support your work in these areas if that's something that you aim to provide, because I really find this focus to be so incredibly necessary to ensure that we're offering competent and liberatory care to all of our clients, especially clients who experience oppression and systemic violence and who have been denied access previously or experienced harm by a mental health system or provider. as counselors, we are practitioners in a diverse world, and I hope that we really can help our clients to access spaces of safety, radical affirmation, and empowerment in our offices, especially when the rest of the world might be telling them that they do not have a right to safety, survival, or personhood. So this is something that I imagine you can tell I'm really passionate about, and that's going to show through. I'm happy to consult. I'm happy to talk more about that. But another thing that I do is I volunteer sometime with an equine assisted psychotherapy practice based out of Asheboro, North Carolina. And this is really powerful work. I really love witnessing and facilitating the healing that horses can offer to clients. And we can also talk more about that if you're interested, if you're curious. So in the past, I've worked in many school settings. I served as a counselor in a school that was for recently arrived refugees and immigrants to the United States. And these students were often dealing with a lot of adjustment to new cultural spaces, ways of living, as well as associated trauma that was inherent in some of these experiences. And then there have also been some other experiences sprinkled throughout my career, but I hope that this kind of overview can give you an idea of my professional roles and my areas of focus. Passion and expertise, but I'm also still cultivating those. And I hope that you all are going to build a career pathway where you can continue to cultivate new areas of passion, of interest, of intrigue. And I can't wait to hear about all of your hopes and dreams as professional counselors. So one other question that I would love to hear about from you all is what you're passionate about. And this can be professionally and personally. So for me, I'll share that I really aim to infuse my passion with my work at UNCP, my private practice, and my day-to-day life in my communities. So as you might notice, I've got a passion for working with queer and trans populations and facilitating access to social justice within these communities, specifically through a lens of intersectionality. So one's experiences of all facets of their identities. For example, their race, ethnicity, ability, sex, gender, gender identity and expression, sexuality, affectional and sexual orientation, immigration status, size, socioeconomic status, religion, spirituality, etc. So I believe that our clients are multifaceted in their lived experiences, and they can often experience barriers to access that I believe that we as counselors have a calling to eradicate. So that's where social justice really kind of hits home for me. Another thing that I'm passionate about is music. I love to go to shows and kind of get lost in music. I tend to lean toward music that's a bit heavier. I play the electric cello. I won't promise that I play it well, but I did used to play in a rock band for a little while, and it was a lot of fun. I don't play anymore with a band, but I just really love to experience music and let it captivate me. But yeah, so that's just a little bit about me. I hope that it has helped you to kind of just understand a little bit about my journey, my walk. And I can't wait to hear about you all and learn more about how I can support you in your journey into this career that can be an incredibly rewarding one. Um, and I look forward to learning about your journeys to this point and where you see this path taking you. And I'm excited to connect throughout the upcoming semester. So thank you so much for tuning in, and I will be speaking with you all soon. So now it's your turn for your video introduction. On your videos, please share your name, your pronouns, and then answer the following questions. And again, I will post a blank presentation on the module for week 1 so that you can just copy that if you would like to. You're also welcome to create your own. And so you will answer the following questions on your slides after you create your video. I learn best in classes where the instructor, blank, and you can fill in the peers and courses help me learn when they, my hope for this online course is, and my fear for this online course is. So thank you so much for participating. Looking into next week, we will review the syllabus in depth and you'll have an introduction to the course. Go ahead and glance over the syllabus this week so that you know what you are looking into for the future of this course. But next week, the reading will specifically be the syllabus and then the chapter 1 in Chaperis and Chaperis, our textbook for the course. And there will be a discussion board that is about any questions that you have regarding the syllabus so that I can clarify those for you. Because we won't be meeting in person, I want to make sure you have a forum where you can ask questions and I can give you answers. And then there will be a syllabus quiz and a chapter 1 quiz. It'll be one quiz that blends both of these topic areas. All right, well, have a wonderful first week, and I will look forward to engaging with your videos and your PowerPoint presentations.